Guess who's back, 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 back again, again, again. My cervix sweater's back, back, back. Tell a friend, friend, friend. Hey everyone, so it is Elizabeth, aka Nurse Zabe, here on YouTube and Instagram, back again with another video for you guys. So for those of you who are new, I am a labor and delivery and postpartum nurse and a certified childbirth educator. And today, if you can't guess by what sweater I'm wearing, we are going to be talking all about cervical exams, cervical checks, vaginal exams, what we as the providers want you guys to know about cervical exams, and what you should know going into labor, what is going to be happening, and how we're going to be assessing the progress of your labor. Before we talk about cervical exams, I think it's really important that we all discuss what a cervix is. For those of you who've not seen my most recent video, where I in fact demonstrated in my cervix sweater what a cervix is and what it does, I can refer you back to that, but I'm also going to go over it here. So, the cervix is the lower part of your uterus. It's the part that separates the uterus from the vaginal canal. It is housed inside of the vaginal canal. And you have a cervix both when you are and when you are not pregnant. Pretty cool. And your cervix, when you are not pregnant, changes its position, its softness, based on where you are in your reproductive cycle, which is kind of neat. So your cervix is made up of fibrous connective tissue and elastic connective tissue, and this is what allows it to open during childbirth. And like we talked about, when the cervix is opening, it's actually going back behind the baby's head. I think it's time that we show you. So when you're not pregnant, you got your cervix pretty close. It's gonna probably feel, if you're feeling it inside, firm, like tip of your nose in the back of your vagina. And again, it changes position based on where you are in your cycle, but it's gonna be pretty close. There is an external os or opening and an internal os or opening. So now that we know a little bit about what the cervix is, let's talk about what a cervical exam is. So a cervical exam is when a provider inserts 2 fingers into your vagina in an effort to assess several different things about your cervix and about the baby's position in relation to the bony prominences in your vagina. We are looking for dilation, so how open that cervix is, and that can range from not open at all to completely open, which would be 10 centimeters dilated. We also are looking for effacement, so how thin is your cervix? This will range from not effaced at all to 100% effaced, where the cervix is basically as thin as just a sheet of paper. So your cervix, which is going to be long and closed for most of your pregnancy. By the end of your pregnancy, if it's 0% effaced, it's still about 2 to 3 centimeters, so it's got some length to it. Will slowly, as you get closer to your due date or during the early part of labor, begin to thin out. Still remain closed or open just a little bit, but it'll get nice and thin, and then it will start to open. We're also going to be looking at station. So when we're looking at station, and I will insert a little visual here, we are looking at where the baby's head is in relation to the ischial spine. So is it at the ischial spine, which would be called a 0 station? Is it 1, 2, 3 centimeters above, or 1, 2, 3 centimeters below? And we're moving that baby through the vagina either while you're laboring or then while you are pushing. You're moving it centimeters, sometimes millimeters at a time, but every little millimeter and every little centimeter counts. A cervical exam can also be used to determine if the baby is head down, based on what the doctor or the nurse is feeling on the baby. Does it feel nice and firm, like a skull? Does it feel like you can't tell what you're feeling? Perhaps if baby is transverse, so lying this way, or does it feel like a little bum or a little foot, or whatever else it could be. If we are unable to confirm that with a cervical exam, then we can always use an ultrasound. It's going to be our best bet to 100% verify that. We're also checking to see the position of the baby, particularly when you are further dilated and your bag of water has broken. We are feeling those fontanelles on the baby's head, and what fontanelle we are feeling can help us determine what position baby is in. So is baby head down like this, coming through? Or is baby more of an OP position where they're like this coming through? We would feel different fontanelles if baby is in a different position. In regards to the baby's head, is there a lot of molding, or has a caput developed on the baby? If there is a lot of molding and our cervix isn't dilating, that can be indicative of a cephalic pelvic disproportion where baby is not able to come down fully, or that baby is malpositioned, and we need to try some different and fun things of moving mama around to try and help baby get into a better position to be born vaginally. So when we do a cervical exam, we're also going to be assessing where the cervix is. So sometimes the cervix is really posterior. This is often before labor starts. We have a really posterior cervix. It's like almost back behind the baby's head. It's very hard to reach. And as labor progresses and as things get more active, the cervix comes forward. And so you might notice during your labor, especially with an induction process, that every cervical exam gets a little bit less uncomfortable because that cervix is coming forward and the doctor is not having to reach quite so far back to reach your cervix. Now that we've kind of gone over cervical exams and what the cervix is, I want to show you positioning for a cervical exam. So when your doctor or your nurse or your midwife performs a cervical exam, they are going to put on a sterile glove, they are going to use lubricant, and then they're going to ask before they perform the cervical exam, hey, is now an okay time for me to check your cervix? And then at that point, they'll have you assume the position. So we're gonna head over to my couch and patient Elizabeth will be there. I have to warn you, I look very put together on top and I'm wearing pajama pants on bottom and I'm not changing, so it is what it is. I told you, I'm wearing pajama pants. Okay, so here we are at my couch. I'm going to show you how we would perform a cervical exam from a couple of different angles so that you can kind of best see. So you are going to be laying fairly flat, maybe tilted to one side slightly. We also can do cervical exams when you're on your side or even in hands and knees position, but this is just the best way to get the best assessment of what's going on. So you're going to be fairly flat. You're going to put your feet up by your bottom, and you're going to let your legs fall out to the side, okay? That will allow everything to be nice and relaxed and the doctor to be able to reach your cervix. The big thing with the cervical exam, obviously they are sometimes a little bit uncomfortable. If there's ever a point in your cervical exam when you're like, I cannot handle this, please let your provider know. Please tell them verbatim, stop. If you want them to stop, because we don't want to hurt you, and I always, if I see somebody getting uncomfortable, I'm like, would you like me to stop? And I will, because sometimes the cervix can be a little bit posterior. So something that we might encourage you to do if we have a posterior baby, you're gonna have the bed flat, you're gonna have your legs butterflied open. We might encourage you to take fisted hands and put them up under your pelvis. This will tilt your pelvis forward and make it easier to reach that cervix that is super posterior. Slow deep breaths during a cervical exam are going to help you to relax. If you need to, having a partner's hand squeeze can be really helpful, and just trying to really remember to breathe during the exam will make it less uncomfortable for you. It will also make it easier for the doctor, because when you're clenching up your pelvic floor muscles, it makes cervical exams more difficult. And we obviously want it to be as comfortable for you as possible. And we want you to know that you can ask us to stop at any time. When or why would we be doing a cervical exam? You might find at your very first appointment, your very first OB appointment, that they do a cervical exam. That's basically just to kind of get the lay of the land, see what everything is looking like. You might also have them do a cervical exam if you are complaining of early or preterm contraction, just to make sure that nothing is dilating before 37 weeks. And then often once you hit 36 weeks, you will be able to get cervical exams weekly at your OB appointments up until delivery. These are optional. You don't have to have them done. Sometimes they can be encouraging and sometimes they can be a little bit discouraging, but here's what I want you to know about cervical exams. What you are currently when you're not in labor, well, yes, it's awesome to start your labor off 2-4 centimeters dilated, doesn't mean anything as far as like if your baby's going to come today, tomorrow, or 2 weeks from now. I know women, especially when it's not their first baby, who walk around at 4 centimeters for a couple of weeks. I also know women who were closed and had a long cervix that wasn't very effaced the night before, and the next day went through labor and have a baby in their arms. So these exams that your doctor does can be helpful in knowing where we are, where we're starting out, particularly if we're getting past your due date, we're thinking we might need to schedule an induction, but they aren't necessarily 100% necessary. They also can be helpful in making sure that the baby is head down and remains head down in that last little stretch of pregnancy. In labor, you will more than likely get a cervical exam upon your arrival to the unit. Anytime we're going to administer medication, so if you are getting induced, before we add anything or change anything, we would do a cervical exam again. We also do cervical exams upon mom feeling like she needs to push, just to make sure that all of that cervix is gone. And the reason why we do that is because if you push with cervix still present, you can actually tear your cervix, where you can lose, one, a lot of blood from that, and two, could cause issues with later pregnancies if you have a torn cervix, particularly if we didn't realize that it was torn. So that's why it's really important before you push, or if you're feeling an urge to push, is to call out to your nurse and let them come in and just make sure that all of your cervix is gone and that it is an appropriate time to start pushing. We might, if things are seeming to ramp up or change, we might get a cervical exam. If you're thinking that you want to get an epidural, we might do a cervical exam before that or after that. You might also get a cervical exam if there is a significant event in the heart rate or in a change in uterine activity where we're thinking, okay, like we need to figure out what's going on. Baby isn't tolerating labor. Are we getting close to delivery, or are we having to consider alternate routes or alternate ways to make baby happy during this labor process? Exams, I think it's really important to remember too, you are not going to more than likely get a cervical exam with every single centimeter that you go. And so you might get checked when you first get there, you're 2 to 3 centimeters. They might check you again when it's time to push and you're fully dilated. So just something to keep in mind. We're not going to be checking you every step along the way. We want to avoid frequent checks, particularly when your water's broken, because we can introduce infection and bacteria into your vagina, even though the cervical exam is a sterile procedure.
Hey guys, it's future editing Elizabeth here. I just wanted to make sure that everyone knows that cervical exams and anything in labor require consent. No one can check your dilation without your permission. The times I have said you might need a cervical exam in this video are just based on my experiences in labor and delivery and what typically would happen, obviously with patient consent. But everyone's labor is different and unique, so these might not all apply to you, and that's okay.
So after you have a cervical exam, it's really, really normal to feel a little bit of moisture. That can be caused by the gel that the doctor, midwife, or nurse use, because it will warm up to your body temperature and leak out a little bit. Also, it can be really normal to have a small amount of either brown or slightly more red, pink tinge bleeding. What's not normal is heavy bleeding or feeling like your water's broken. Not that that's not normal, but if you feel like your water's broken, please let us know. Those aren't what we would consider normal, typical finds after a vaginal exam or a cervical exam. That's everything that your nurse wants you to know about cervical exams. Let me know if you learned anything down below. Let me know how your cervical exams have gone so far. Thanks so much for watching. Bye guys!